I'm Al McFarland, editor and host of Conversations with Al McFarland. Today, I'm happy to bring to you heart-to-heart conversations with our partner, the Minneapolis Heart Institute Foundation. So today's conversation is the first in a series of 5 conversations. We're going to use this time today to talk about the work we've done in the health disparities reduction space and to talk about how we're working together to advance health equity. Joining us today for this conversation, this introductory conversation of our Heart to Heart series, are Stella Whitney West, who's CEO of North Point Health and Wellness, Dr. Mosi Bennett, he's a senior cardiologist with the Minneapolis Heart Institute, and Dr. Courtney Jordan Beckler, medical director for the Minneapolis Heart Institute Foundation's Emerging Science Centers. At Insight, we've had a long history of addressing health disparities. We've created a section that we call Insight to Health. We launched a project several years ago with the support of North Point Health and Wellness and Southside Medical and Open Cities in St. Paul, the 3 that we call the legacy anchor health resources in the Black and communities of color in Twin Cities. We launched a project that focused on fitness and nutrition and health, was called Insight to Health Fitness Challenge. And obviously that has had to morph with the advent of COVID-19 and the restrictions of assembling people together. But what we're doing now is creating the next level, the new iteration of our interest in that space. And that is the creation of a project led by Batala McFarland, my daughter, that's called Insight Health Equity Action Lab. IHEAL is the acronym. I love the name. I love the spirit of it. I love the idea. At the center of it is healing. And at the center of it is the responsibility of each person to take his or her health personally, take agency, and to engage resources, assets, and community to ensure personal, family, and therefore community and public health. And I think that's what we're going to do over the next several weeks in these sessions that we're calling Heart-to-Heart Conversations. I want to begin by introducing the team that's here today that'll be involved in developing these important conversations. And I'm going to start with Courtney Jordan Beckler. Courtney and Batala have been collaborating one-to-one to bring this idea to fruition. And Dr. Jordan Beckler, thank you so much for your leadership, your guidance, your story. It's a fascinating and powerful story. And introduce yourself, though. And after that, I'll ask Dr. Bennett to do the same and Stella Whitney West to do the same. Dr. Courtney.
Thank you, Al. It's so great to be here, and I'm thrilled to be kicking off this series with this esteemed group of people. As you mentioned, I'm a cardiologist and I specialize in prevention, and I also have my master's in epidemiology and public policy. And for me, I have this just this love of all of it, which is kind of one of my challenges too, but how we can do better inside the clinic and how we can do more with the community and really look again at what keeps us all healthy. I think in terms of my own individual why my father is African American, and I have always felt like there's sort of this club, particularly as a physician, in seeing how things can be done differently and we can have these different outcomes. But sometimes it feels like there's only a certain group that knows how to navigate that. And I continue to feel like we can do more. And so I'm really excited. Part of what drew me into medicine is the art. And I think so much of that is what you do, Al, the storytelling. And that's what's so exciting to me. Each patient I meet, each population and neighborhood that I get to know better of what ultimately makes them thrive is completely unique. And putting those two together to create healthy folks and populations is what I love. So thanks.
Thank you. Great You know, we've done an interview before. I tell you, may I call you Courtney for this program?
Please do.
Dr. Courtney, just talking to you is both illuminating and inspiring. The stories you tell. One of the meetings we talked about, you shared a story of a patient, and I can tell you that personally it brought tears to my eyes because I felt the deep empathy that you deliver and bring to your engagement. And that empathy itself is just fetching and touching. So I want to tell you, acknowledge that there's that powerful value in the approach to serving your patients and our community that is so important. Let me go to Dr. Mosi Bennett. And Dr. Bennett, same thing. Why don't you introduce yourself and tell folks who you are? And I'll ask all of you questions later on that take it to another level. I can tell you that my forte as a journalist is what we're doing right now, listening intently and asking good questions. And I see now an opportunity to have a lot of fun in this conversation. Dr. Bennett.
Well, thank you, Al. It's really a pleasure to be here. Thank you so much for the opportunity. My name is Mosi Bennett. I'm a heart failure cardiologist, a cardiologist focusing on heart failure and in every stage of that illness. In terms of my background, I grew up in Baltimore, Maryland. And I was really, I went to Johns Hopkins there in Baltimore, trained also in Cleveland, at the Cleveland Clinic, and have been in Minneapolis for almost 8 years now at the Minneapolis Heart Institute. This has been a dream in terms of doing what I love. I've been drawn to cardiology, specifically to heart failure, because of the opportunity to make connections with my patients, to see people through various stages and aspects of their health and help to get them better. So working with preventing cardiovascular disease, to the other extreme, seeing people when they're at their extreme illness and working with them to get better. And that could sometimes mean a heart transplant, a mechanical heart pump, but those are heroic measures that we take towards the advanced stages of disease. But just as important is prevention, making a connection with someone and working with them through their over the years. And that's really what I've been drawn to. So it's really a pleasure to be here to make this connection and continue the conversation.
I know that Dr. Bennett, you've got a particular and specific interest in veterans, and I thank you and applaud you for that. I am a veteran, and I'm active in a veterans organization in North Minneapolis, the American Legion, the Johnny Baker Post. And it's the only, I think, existing Black veterans service club in the state remaining. There may have been others earlier. So I'm hopeful that we can talk about your work and thoughts about veterans in the course of this hour. And I want to thank you for what you're doing. Stella Whitney West, CEO of North Point Health and Wellness. I call her one of the guiding lights, the powerhouses in Minnesota and certainly in North Minneapolis. She's been a leader, a visionary, a builder, and producing results in the life of the community and in the lives of residents of the community. Stella, good afternoon. Unmute your mic and please, you take the moment to introduce yourself and the program at North Point.
Thank you, Al. I am thrilled to be a part of this esteemed panel group, and I've known Dr. Courtney for a number of years now at different places that she has landed, but always the connection with the work that we do at North Point with community health and the work that she does in terms of clinical as well as policy and at the state level. So it's really exciting to be reunited with her once again at this level. And it was great getting to know you, Dr. Bennett. And so I look forward to an ongoing conversations in partnership with you as well. So I'm the CEO for North Point Health and Wellness Center. I've been at North Point for 16 years, and most folks know us sometimes as Pilot City. We are a federally qualified health center or a community health center. And we have a comprehensive medical, dental, behavior health. We also have an on-site pharmacy, laboratory, and we also have a nonprofit that provides what we call the social determinants of health. So our approach to health within the community is looking at the community that we serve, which is over 90% community of color. So 50% African American, 30% Latino, and another 12% Southeast Asian, predominantly Hmong. And so we are a health organization that thoroughly believes that it's important that the staff within the clinic reflects the patients that we serve, and that the leadership throughout the organization reflects the community and the people that we serve. So we have a community board that is majority of the board are patients, and so as the CEO, I report to that board, which I think is the way all health service should be delivered. Any service that is customer facing, because what could be more important than making sure that your customer or your community is really what the end goal is, what the outcome is. And so to have them in the driver's seat, I think is extremely important. I'm a lifelong resident of Minnesota. I was born and raised in the Rondo community in St. Paul. And as we were talking about veterans, I come from a family of veterans, all the way from my grandfather, my dad, my uncles, were all in various parts of the military. And so I think that having a conversation about veterans within our community and their health needs is something that I'm very, very interested in. So one other thing about North Point is that we have this partnership with Hennepin County. And I always feel like that we have helped the county to show up differently in the community. And I think it's been a very valuable partnership. Hennepin County brings a lot of resources to the community, but oftentimes they show up as I say, the 800-pound gorilla, and not understanding how do you work within a community. And that's slowly being turned around, that they show up and understand that they need to partner with the community in a true partnership fashion. So a lot of great things happening there. Thank you.
Thank you. Let's talk, Courtney, if you would, about the Institute. What's the Institute's mission? What's the story?
Yeah, so the Heart Institute is the largest cardiology group within the state. We recently have merged with our colleagues now on the east side of town, also in St. Paul. The former United Heart and Vascular Clinic is now the Minneapolis Heart Institute East. We have a group of cardiologists and cardiovascular surgeons and vascular medicine specialists, along with our Heart Institute Foundation, which is really where we work to educate. And so that's from communities to other clinicians, as well as other cardiologists, other fields within medicine. We do a ton of research. So we are one of the leading Midwest research institutes, and that foundation helps support that effort also. Our mission, which is part of how we got interested in kind of working together is to end heart disease for all. And I think Dr. Bennett and I have had a chance to look at that and say, we're really proud of the work that we're doing for the people we touch. I think both of us would be happy to have a member of our family come and receive care in our institute or be a part of our research and our education opportunities. But we both feel like there's a lot of opportunity to do better in the for all. And I think both of us at the national level have had a chance to look at that data. And I'm speaking on behalf of you now, Dr. Bennett, but that I personally feel like what drew me into cardiology was these fixes, these second chances. It's different than many other disease processes where we don't have the same type of solutions. So I think we're here authentically to figure out how we work differently with taking the community's lead on a disease that we feel like has a lot of opportunity and continues to be the #1 killer for Americans, for Minnesotans, and disproportionately for African Americans.
And so what's the profile in North Minneapolis? We're based, Insight News, based in North Minneapolis, but we serve the entire metro area. And one of our intentions is engaging in this partnership with you and with North Point to focus on North Minneapolis to start with, because we are centered here, we're based here. And so I'm wondering how that aligns with the work that you have at the Institute and sort of why we're moving in this partnership, because you've got great experience, great knowledge, and great resources to focus on and to educate and to help our communities understand what we have to do to protect and maintain our health. What is the look of the arena that we're looking at in North Minneapolis from your data?
Yeah, so unfortunately, when we look at our data, what we see is that once folks get to us, right, and to be clear, that this isn't meant to be a selling thing for the Heart Institute, it's meant to be for cardiologists, but we see, take Minnesota, for example, we have the best cardiovascular outcomes in the entire country. And we have since 1999. And having been previously at the Department of Health for Minnesota, we believe strongly that part of that is because of collaboration. But when you start looking deeper at that, what we see is we do not see equal outcomes for everyone. And specifically, some of the worst outcomes in the state are for our African American population. And as you mentioned, Stella, we're able now to look at from a zip code analysis, and we see that specifically looking at, say Medina, which has the highest life expectancy in the state, as we compare that to North Minneapolis, and we see a huge discrepancy. And we see the same thing when we look on the east side of town, when we look in the Rondo neighborhood. And so Mosey and I have started to look in our own data, and part of what we see is once folks get to the cardiologist, we often have equal outcomes to our white counterparts. But unfortunately, it looks from our early vantage point, and this is something that we're looking into further, that we have a lot of work to do to, in my opinion, build that trust with communities, make sure that it's easy, it's accessible, that folks feel comfortable. We've got a lot, I think, to learn from the past. And I think we just both feel that the way to do that going forward is with the community leading that and helping us understand what that looks like.
Dr. Bennett, is the story the same nationally? Is Twin Cities or North Minneapolis dissimilar from the experience of Black and Brown populations around the country in your work?
I think what we see in North Minneapolis and in neighborhoods in other neighborhoods around Minneapolis mirrors what's going on across the country, whether it be Baltimore, Maryland, or Cleveland, Ohio. I think that any way you look at it, what we see are these disparities. And I think the reason that we're having this conversation is to raise awareness of the fact that there are these disparities, and more importantly, try to come up with solutions to address them. I mean, it's a fact that if you look at heart failure, for example, that it affects people of color when they're younger, more severe. A lot of the preventive health measures that can prevent the development of heart failure are less likely to be in place. And the first step is our awareness of these disparities, which we see in North Minneapolis, but really are occurring across the country. And so I think this is an important conversation that we're having now.
And so, Courtney, we've created a series of 5 programs. This is the first to introduce it, and the 5 or the 4 remaining sort of are a combination of a curriculum of 8 really sessions you've created. Walk us through what's going to be covered in this series and how we're going to do it. I've got a role to play in it that I'm excited to talk about as well, but why don't you describe the general structure and the course that we're offering?
Absolutely. So a couple of years ago, I created a curriculum that I first piloted with the YMCA where, and I'm sure that you feel this too, Mosey, that there's so much that you want to say outside of the exam room, and that time gets sliced down and down and down. And it's unfortunately, it's just the way healthcare is. So for me, I wanted to find a way that I could put those pieces of information and education into longer series that basically empower the human, the patient, when they're dealing with me, to have it be a little less of a hierarchical relationship, and to flatten that so that patients can feel empowered to ask the questions that they need to understand the disease process better, and ultimately to be the one to claim their health and thrive, whatever that might be on their journey. So the series that I started is a combination of a little bit of 101 of heart disease, so people can actually understand what heart disease is, how it happens, just a little bit of the pathophysiology, if you will, because there's so much confusion. My father refers to me frequently as a glorified plumber, and understanding the difference between the electrical side, the plumbing side. I often talk about the valves of the heart as being like the windows on a house, but it's so confusing, I think, in the beginning. So we'll have a little opportunity to talk about that. We're going to spend a lot of time having a chance to interview people like yourself, Al, which will be exciting for you to tell your story, and then within that to interject what's worked and what hasn't worked from your vantage point. And I have found that's most successful with people, because when you come from a physician side, I think it's not real. It's not what actually works. So we'll talk a little bit about basics of medications, what people can expect. That's another thing that I have found is really empowering to people. When they understand how a drug works, it changes whether or not they might want to be on that. When they understand a little bit about why we might recommend a beta blocker that, yes, might make you feel tired, but why it's making you feel tired, then you get to weigh those options a little bit more and understand the pros and cons. And I've just found that that's been tremendously helpful. And then we'll have a good chunk of time to talk about lifestyle. And one thing that I've found is that we really have to be clear that this should not be a shaming process. This, again, should be back to that empowering piece for you to understand what might be in your purview to help influence your path going forward. But I've had a number of people come out and say, when we emphasize the prevention side of things, sometimes it's hard to kind of admit that you've gone through this, where that's not the goal at all. It's, again, to keep things nice and level and have you feel best equipped to understand all of the things that might be in your control with the right community infrastructure to help you. So it's going to be fun.
I'm excited because when we talk, you're going to be interviewing me, giving me a chance to tell my story. And I can preview that a little bit right now, if you don't mind, because I think it's an important one. And my mission, my goal is simply to share in a way that it might resonate with somebody else that's like me or not like me. In doing this, I want to always acknowledge and thank my daughter, Batala, who on occasion after occasion in the course of our lifetime has called to my attention things that I need to pay attention to. And that begins with the fact that, 5-6 years ago, when she brought the idea of going to a trainer up, actually she brought the idea first of bicycling, riding. Dad, you're overweight. I've been overweight all my life, right? And I drink, and I love my wine, right? And I used to smoke. I don't smoke anymore, but I certainly have been sedentary for long periods of time, working, grinding, and going through stress and not paying attention, not dealing with self-care. And early on, she said, why don't you start bicycling with us, right? And I said, sure, of course. And I said that for a couple of years. And then finally, the guy she connected me to, all of you might know him, Anthony Taylor, who was active in the Major Taylor Bike Club, would say, Al, Mr. Mack, come and ride. I said, sure. Mr. Mack, come and ride. Sure, right? It never happened because I was always too busy. So one day, Anthony shows up with a truck and 2 bikes on it. We're riding today. And that's what it took to get me on a bicycle. And I loved it. In the first year, I actually rode even through the winter and started riding to work, riding to my customers downtown, and had a great time. I've ridden less, but I did it and I know I can do it. Then after that, she introduced me to a young man who was a gifted personal trainer in St. Paul, Tyrone Minor. And Tyrone Minor and Insight launched the Insight to Health Fitness Challenge, right? And we had several years of phenomenal engagement. Our mission was to create training for me personally, but how do you do something that's bigger than you, better than you? You bring your neighbors, your friends, your family, community into the story. And from a newsman's point of view, my goal has always been to create laboratories, a laboratory in which 3 or 4 or 5 or 10 or 30 or 40 of people can gather and talk, interact, but to document that and include and share that interaction with 100,000, 200,000 people using the newspaper, using radio, using social media. And so towards a couple of years ago, I was at one of our sessions down at Heritage Park YMCA, and regular 5, 6 in the morning workout, hard sweat. Dad, you're not looking so good. Really? Didn't know it, wasn't aware, but she persisted and came home. She and my wife, Bobby, insisted that I go to the clinic, and the diagnosis was congestive heart failure. So it was a new experience for me. So I'm on that path right now. So I'm excited to talk about that with you and to have you ask me questions, because I'll be learning, because I don't know. I mean, I know where I am, but I need more information. I need the counsel. And I also approach this as a journalist. I want to share it with people. So that's what I'm excited about. Dr. Bennett, what does that mean for you to have an Al McFarland who's got a high profile and got connectivity to be able to reach out and expand, build this narrative about, number one, being aware, and that we have the power to live and live decent and improve lives with the proper support from your profession and from agencies like North Point. What do you think?
I think your story highlights several things that are very important in our approach to heart failure and having success in getting people better. So it's not simply taking pills. It's not simply following instructions from a physician. It's actually taking ownership of your own health and realizing that most of the hard work that takes place is done outside of the doctor's office or the hospital, and it's never too late to start. If you can build a community or social aspect to your journey to wellness, or your as you navigate through heart failure or any cardiovascular illness, there's a higher chance of success. And certainly, we're not doing this alone. If you look at the prevalence of cardiovascular disease, if you look at the prevalence of hypertension and heart failure, there's a very good chance that someone standing next to you is going through the very same thing.
Mm.
So by building a community, by building a support network, you make everyone's journey much easier. And certainly by having a microphone and having a presence and a voice, I think that it becomes much more powerful and more effective.
And so even with, I call myself semi-informed, I'm not completely informed, but and I'll say this to you when we talk, Courtney, next week, Dr. Courtney, I'm still scared. I'm actually scared. I really am. And I'm saying that as plainly as I can. I am fearful on a daily basis about my health and about my heart. Sometimes I'm paranoid, maybe reading into things more, but also not wanting to dismiss something that is important that I should pay attention to. Stella, how do we train, educate, empower our community, people like me, my neighbors, my family members, to develop and be guided by confidence of knowledge and access to information? Your presence here as North Point Health and Wellness is so critical to our community, not only for the things that you do for individuals within the community, but for the idea, the brick and mortar, that you have and that you're creating symbolizes that we're paying attention in ways that we haven't before. Talk about that if you would, and respond to my soliloquy about being a patient who's really seeking to live and to live a long life.
Thank you, Al, and thank you for sharing your story, because I think that is certainly one of the key, most important elements, is that we have the courage to share our own personal story with others, and then because it makes a difference when people can see themselves in other people. As you were telling your story, and actually, I thought about my own story. I have high blood pressure, hypertension. My father had high blood pressure, and he's also a diabetic. And so it's one of the things that I think within our community, even within our family, that has become almost an expectation or institutionalized, that, oh, yeah, well, everybody in your family has high blood pressure. Of course you got high.
Mhm.
And, and those are the kinds of patterns that we have to disrupt, to say that you don't have to have, it doesn't have to be it's your story now, but it doesn't have to be your ongoing story. That you can, there are things that you can do so that you don't have hypertension, or that you are not on medication. And so some of the things that I've done, and I know there's other things that I need to do. But one is that I have a home blood pressure monitor.
Mhm.
And it's one of the things that we do with our patients. We partnered with one of the health plans who said, hey, we want to make a donation of, it was like 500 home blood pressure monitors. And we're like, yeah, get them out to our patients, so that, because they talk about high blood pressure, right, is the silent killer. And that's because it is. A lot of times, the first time people realize that they have high blood pressure is when they end up in the emergency room, right? Because they're either having a stroke or a heart attack or something. And then you think about that, the very first thing you need to do is to make sure that people are aware, right? And then give them the tools so that they can begin to change some things within their lifestyle. So So I check my blood pressure daily, make sure that it's being controlled, that I'm happy about. But I also know that the lifestyle changes, hearing your story, and I'm thinking to myself, oh my goodness, I remember, right? I remember the workout with Tyrone. And I'll say I was one of those where like, I mean, and he pushed hard and I was one like, okay, I'm done. I'm not gonna stand all this. What? But now that I think about it, it is about that was for my own good, right? Right. So I should have stuck to that. But I am with my other gadgets, counting steps, which is great for me because it has become a way that I challenge myself that each day, you know, I'm going to get in more steps. The goal is to get those 10,000 steps, and doing things. And it's even gotten harder because in this COVID, we're all on Zoom. So I found myself, I'm sitting all the time. Whereas before, even though I had meetings all over the campus within my organization, but I was getting up and I was moving. So it was a lot easier to get the steps in. So now I've got to be more intentional about getting that exercise. But one of the things that we have learned, and I think, and I don't remember if it was Dr. Courtney or Dr. Bennett that mentioned the fact that um, at least 80% of what needs to happen or that impacts overall health is what happens outside of the clinic, outside of the brick and mortar, what happens within the community, within everyone's daily life. One of the things that, and Dr. Courtney and Dr. Bennett certainly may be aware of this program, and it was the Minnesota Heart Health Program. And I used to work for the Bloomington Heart Health Program way back. And it was a 10-year study. And Bloomington was the intervention city, and there was a control city. And the whole idea was that you could prevent heart disease by making changes within a community. And I mean, we made changes with all of the restaurants, the food establishments, the red hearts on the menu so that people knew what the heart healthy choices were. We worked with the churches to make sure that there were free, accessible exercise programs, cooking classes, the whole thing where you come in and you change a community by making sure that you're working with all of those factors within a community. And I know you, Al, have talked about creating a blue zone, right? In North Minneapolis. And we can do that. We need to do that. It needs to be that the community as a whole is thinking and doing things that are going to create a healthier community, which is our mission, partnering to create a healthier community. So we have always used community health workers that come from the community, that are working in the community. We have always had health screenings out in the community. I can't tell you how many people will have come up to me and said, and I remember this conversation vividly because it was an elected public official. And he came up to me and he said, North Point saved my life. And I was just like, whoa, what happened? He says, I didn't know that I had high blood pressure. He said it was at one of your health screenings, and they took my blood pressure, and he said I could kind of tell something was wrong. They took it again, and then they made a phone call, and lo and behold, they were taking me to, oh yeah, you need to go into the hospital. Your blood pressure, and it was really high. And he since then became a patient of ours, and was an elected official, but was on medication. And he talked about the fact that he never knew, had no idea that his blood pressure was that dangerously high. So I say all that to say that we have to be more intentional, aggressive about getting the message and getting the interventions out in the community where people are at. We have found that we've done some demonstrations around group visits, and actually we did one around hypertension patients and made them into group visits. And we were able to document that their outcomes were much better for those patients that were meeting in groups. And the reason why was because they were supporting each other. And it became, and that their attendance at the group was great. They started sharing recipes, ideas on how they were able to make changes. And so there's a lot of information on how we can engage community within the community. And that's what has to happen. Has to happen before they get right to
Mhm.
you, Dr. Courtney, and to you, Dr. Bennett, and they've got the cardiac disease. We want to make sure that the prevention side and even the intervention, so that when they do get that diagnosis, there are already within the community, just like Al shared. It took Anthony Taylor to show up,
Mhm,
right, with a
mhm.
bike. And once you got on that bike, and I remember how you rode around and you were on that bike. It was a black bike,
Mhm.
it was like 10 speeds, and you were riding it everywhere.
Yep.
You were riding it everywhere. And so we have those resources in our community. We've just got to be a little bit more aggressive and intentional about it. It's kind of like we kind of know what works, but we've got to do what works. Mhm.
So I'm thinking, Stella Whitney West, about the critical role that North Point plays in the community. And I'm really pleased that we're having and creating this partnership between iHeal, the Insight Health Equity Action Lab, and the Minneapolis Heart Foundation, Minneapolis Heart Institute. And what could come out of this? What would be a deliverable that you think would benefit your mission and vision at North Point, health and wellness for our community? And I want to ask the same question of Dr. Jordan Beckler and Dr. Bennett. What ought we be together striving to produce and deliver for each other and for the work for the community? Stella, you first, and then Dr. Jordan Beckler.
Well, I think the to be able to take the research and clinical knowledge that the Heart Institute has, and to be able to have it through organizations, community-based organizations, clinics like North Point, that partnership, that translation of the how do we take this information and what does it look like on the ground within the community. One of the things that is always a struggle within communities of color is that they're not involved in enough research or clinical trials. It has become one, and we know the history behind that around the mistreatment of communities of color and African Americans when it came to research. And so we know that that's a challenge that we're facing now with the vaccine for COVID-19. People are like, well, how are we going to get it into the communities that are most impacted, because there is automatic distrust of wanting to be considered a quote unquote guinea pig. And how do we know? Because I've heard people say that, how do we know the vaccine that is coming to our community is effective, or that it is in fact high quality, right? And so I think to be able to have that type of partnership that also brings the trust that is needed with research institutions like the Heart Institute. So I just think that there's just a great opportunity. And when we talk about heart disease being the number one killer, it still is. There was a week, I think it was last week, where COVID for that week took number one. But when you think about all of the areas around heart disease and how we can, you talk about having a heart healthy lifestyle. All of that has not only an impact on your heart health, but on your mental health as well. Because when you are exercising and you are eating right, it also has an impact on your overall mental health as well. So I think that there's an excellent opportunity, right? And all of you folks I really like working with. So I think, yeah, we're on to something here.
Courtney,
That's
jump
right.
in. Courtney,
Yeah.
talk about.
So 3 goals that, are really, I think, aligned in what you're saying, and then aligned in our mission. For me, it's educational, clinical change and outcomes, and research change. And so again, starting on the educational piece, I just would love to see everybody have the same opportunities in terms of knowledge to know what contributes, what's in your power, how you could change it, how you, as you mentioned, with your community health workers, what does that look like for somebody that lives where I do, shops where I do, how are they doing it? So I think that's a huge piece. I would love to see, after admiring the data for, over a decade now that we get at the Department of Health, and that I spent studying in my fellowship of, you see this stuff and you see what we can do to change outcomes. How do we actually move that needle? And so how do we, wherever you're at on that journey, how do we make it so that you don't move to the next one? So like you guys have talked about with high blood pressure, well, that is a win that you have a cuff at home, your numbers, and you can get on medicines, because then that means you're not having a stroke. Then that means that for the next generation to come, you're breaking that cycle, and it's not written into, which we know it is not genetic, that's not there. So I'm excited to see that change in physical numbers, again, through the community saying how that looks, how we do that. And finally, from a research perspective, Batala and I were having a conversation earlier this week specifically about the vaccine. And I mean, Mosey and I did grand rounds for our own colleagues and specifically talked about the past and Tuskegee trials, and as early or as recent as 1995, when horrific research was going on young African-American boys at esteemed academic institutes. So I know all of that is there and real. My aunt lived and worked in Tuskegee after the trials, and it was horrible. But what do we do now in 2020, where the research that Dr. Bennett and I are a part of, we know gives people an advantage to participate in? So how do we overcome that barrier in real time, to have transparency, to have, the community help design it so that there's comfort and trust and authentically, everyone feeling that their interest is the interest, because I think that's something for me that I grapple with as a researcher, knowing that, gosh, when you're a part of that in 2020, who knows what it was like, because I wasn't a part of that, and I know the outcomes that are there. But now you get to be the first one to know about a new drug. You have more hands and touches on you, and so your blood pressure is better controlled, or you have better heart failure management, all these things that maybe haven't been covered by health plans yet. So I think that the only way to a path forward is having people in real time tell us what it would take to get there, to change the perception and ultimately trust. So those are my interests.
Great. Dr. Bennett, I'll have you finish up the program by talking to the same point. What ought to be a deliverable that our interaction means for our community. And in the course of that, because we're going to close out in about 5 minutes here, I want you to also address your passion for working with veterans. I'm a veteran. I thank you for having an interest in the veteran population. But what can this partnership do for our community?
That is the million-dollar question, the most important question. Once we identify the problem, once we identify where we need our goals and how do we do it. The issue of trust, I mean, that's such a huge barrier to overcome. And it really involves building relationships. If I were to come into a new community and try to enroll people in a research study, of course it would be met with skepticism and concern. But if it starts with building a relationship and understanding the importance of controlling your blood pressure, knowing what your blood pressure is, and then having a conversation about a new research study to look at a new blood pressure medicine, that's a different approach, and it's more likely to succeed. So these are incremental, small steps. It's not all or nothing, but I really think it starts with just building a foundation, whether it's a presence, a face in a new community, whether it's a screening for education, a forum on the importance of something like controlling your blood pressure or providing access to a blood pressure cuff. It starts with those steps, and you have to work from there. You can't try to do too much up front where, let me sign up 100 people for a research study without laying the foundation. So we have to take this in steps. And Al, in terms of the veterans, I think that it's certainly a population of our society that has historically been underserved, well-deserved, and fraught with a whole host of health issues, from cardiovascular to mental health. And it really has highlighted some of the disparities that we're talking about today. So I think, for me, that's a special concern. I have a special interest in helping that population. And you remember that I told you a story about a patient of mine, an old veteran who I met this past fall in his first visit to see me in the clinic. He had been in various aspects of interactions with healthcare for his entire life. It's almost 80 some years. And when I saw him in clinic, his face just lit up, and he just couldn't. He was just so happy, and he said he was so thrilled to see me, and he expressed that, and it made my day. And that here was someone, and he said that in his entire life, his entire journey through managing his health and dealing with illness, he'd never had a Black doctor, and that touched me. And we both, just kind of had a moment there in the clinic, and I realized that was a special connection. That I knew that he would come back. I knew that we were working with a certain built-in trust, mm-hmm. And I used that to further his health. And made sure that we had frequent follow-up, phone calls between clinic, and going that extra effort, extra mile to help. And the results are tangible. His blood pressure is controlled. He has access to and is taking the medicines he needs for his heart. And and the relationship with me is a positive one. It's just as much as I look forward to seeing him in clinic, it goes both ways. So you can't really change the world just by taking care of one patient, but I think you take it one step at a time, and if that's one example of a way to break down disparities, I think we can go with that.
Well, listen, this has been a wonderful conversation. I'm so excited to have this program and to have heart-to-heart conversations. I want to remind people that on the 17th, a week from now, we'll be beginning the series of 4 additional programs, the curriculum developed by Dr. Courtney Jordan Beckler, engaging professionals and people, life real-time stories to examine, options, challenges, approaches, but doing it in a way that puts front and center the voice and the experience of our neighbors, ourselves, the community. And we're excited about this. We hope that you, as we share this video with you through the week, listen to all of it or parts of it, but decide that you'll be part of this journey of exploring, examining how we move towards creating more knowledge and more positive results around the area of heart health and health in general in North Minneapolis. I'm going to end with this. Stella, I have often said that North Minneapolis is ground zero for massive disparities in health and massive disparities that are connected, involving economics, education, wealth, etc. And I'm the kind of guy, and I think we all are the kind of people who look at a situation and choose not to look at half empty, but rather half full. We've got assets here that we can grow, build on, and we have the capacity in our internal training, our genius, our desire to move ourselves and our community forward, and we can move towards sustainability. So I look at the problem, Stella, as an opportunity. And you've heard me say this before, our health is our business, right? So I'm looking at the business of making our community not the worst health space in Minnesota, but what would it take to convert North Minneapolis to the most healthy community in the state of Minnesota? I think it's a vision worth articulating, worth sharing, and worth establishing the steps that get us from here to there. With that, I'm going to say, listen, thanks, Dr. Courtney Jordan Beckler. Thanks, Dr. Mosi Bennett. Thank you so much, Stella Whitney Weston. Thanks for the partnership that we're creating between the Minneapolis Heart Institute and the Heart Institute Foundation and Insight News through the iHeal Insight Health Equity Action Lab to address the question of health improvement, of sustainability in our community. Thank you all so much. And I want to invite everybody to show up. Here, we'll be doing this as a Facebook Live program next Tuesday, next Thursday, the 17th at noon. We'll begin with our program. We want you to share this and have people show up and be involved in the process. I'm Al McFarland, and I'll see you next time. Take care. Goodbye, everybody.
Bye. Thank you.
Thanks.